All this is Dr. Mubin Sayed from drbean.com. Welcome to one more show. So the discussion today is about a study from Yale. It is part of the Yale LISTEN study. I actually had talked about one of the earlier study from the same Yale LISTEN study cohort. That study was about the post-vaccine syndrome patients, that is vaccine injury patients, and their immunological picture. This is another study now from the same LISTEN study cohort, where for the first time ever, the researchers have shown that there is a difference in symptomatology of the patients who are long COVID versus patients who are vaccine injured. So I think you can notice the importance of this study. We have been talking about long COVID and vaccine side effects for a long time. Most of the time, we discuss that the spike protein is a common denominator in both the diseases, and so many of their symptoms are actually overlapping. This is the first study that demonstrates that, yeah, there are hundreds of overlapping symptoms, but there are certain symptoms that are more common in the vaccine injury patients, or as they call it, post-vaccine syndrome patients, versus there are some symptom sets or symptoms that are more common in the long COVID patients. This is a groundbreaking direction that they have given. And as we continue to move in these directions, I am sure now we will understand more about the vaccine side effects. And the idea that the vaccine side effects probably just do not exist isn't that how the mainstream medical system actually behaves? Um, so I think these studies would actually bring us towards a direction where we can see what is going on and then see how to help them or how to improve the vaccines. So with this, let me actually show you the study. So I'm going to share my screen. So let's start from here. This is drbean.com. So if you are looking for CME lectures, please go there. It is a beautiful area with lots of good lectures. Then here is react19.org. And this study, why do I have them over here? One, I hope you know that I'm their medical director, plus I'm their content director. Here on the React 19, I did this study, which I did and posted it on YouTube as well. This is the first study, I think it came out in February of this year from Yale. And this is about the immune system difference of the vaccine injured compared to long COVID. And I did lots of drawings and explained it. This is that study. Comparative analysis of long COVID and post-vaccination syndrome. So this is their latest one. If you see here, the date will be August 16, 2025. So when I said this is that study, the study that is related to this video is this one. Immunological and antigenic signature associated with chronic illness after COVID-19 vaccination. This is a really important study to look at, to understand what are the what are the immune system differences. I believe I wrote an article as well on Substack about it, and I did this video too. So I would really encourage you to watch that video and look at this study. Then after looking at this study and seeing what is the immunological difference between the long COVID and vaccine injury, then look at this latest study, which is the comparative analysis of long COVID and post-vaccination syndrome symptomatic analysis. So let me now show you what the differences, what they found. And by the way, the doctor, if you see here, out of these researchers, Dr. Mitsuaki Sawano, I interviewed him from the React 19 side last week. So his interview with me, he's a cardiologist, he's an MD, and he has worked on this study as well. His interview will be published on React 19 site. Hopefully next week, we'll get it edited and updated. Okay, so what is this study? This is a cross-sectional analysis used questionnaire data. So that is a limitation of the study, that it is a questionnaire. So you send me a questionnaire, which I have to fill. So it is kind of self-diagnosing and self-analyzing kind of a questionnaire. So that is a limitation of the study. Cross-sectional means that it is not a longitudinal study. It is not over time. It is not looking backwards. But at one time, at one point in time, you pick a number of individuals from this listen study, and then you do analysis on them. So that is what is called a cross-sectional study. This cross-sectional analysis used questionnaire data from the decentralized Yale Listen Immune Symptom and Treatment Experience Now study. And decentralized here means that it is a remote study. So I receive the questionnaire here in my home and I fill that and I send it back so that I'm a decentralized person in the study. The data was collected from May 2022 to July 2023. So more than a year, I believe, right? Data analysis occurred between July 2023 and May 2024. So decent size of data, decent window as well. A convenient sample of adults aged more than 18 or above with either long COVID or PVS was included. Convenient sample here means that it is not that you are randomly choosing people, but instead you're asking people who are available to participate. And so those who found it easy to participate, they participated. So that is what is called a convenient sample. Now, what are the outcomes? What they did was they measured symptom data were analyzed using clustering techniques. So for the first time, at least in the long COVID and vaccine injury comparison, they looked at the clusters of symptoms that tended to be different between the two groups. Of course, there were hundreds of them that were similar, overlapping, but then there were clusters that were different. And they used AI-based algorithms as well, which they call a gradient boosted machine learning model. So that's a normal AI algorithm. What that algorithm does is that if you give it a bunch of variables, in this case, the symptoms, it would try to figure out the gradients or where are more concentrations on which side versus another side. So in this case, let's say long COVID and vaccine injury. If there is the gradient outcome is 1, that means there is no difference. They're all 100. My network died. I have no idea how long back the network died. But my network has this bet with me that anytime I'm doing a live, it has to go down. Okay. So I do not know how much did you miss, but there is a gradient boosted machine learning model where the AI system is looking at the clusters of the problems. And then based on those clusters, it is trying to tell us or analyzing that which cluster of symptom belongs more to which side of the problem, either long COVID or the vaccine injury. So my question to you, can you hear me? So sorry. It has to go down every time I do a talk, even if I do it after months. So Jim, you said frozen. Am I back? Am I good? Am I back? Okay. So Janet says, yes, I'm back. So thank you, Janet. I'm back. All right. So continuing, they did the clustering analysis to see the clusters of symptoms, and they did AI-based analysis to try to figure out which symptoms are occurring more frequently in which group, and can we positively differentiate between them. So they did the area under the curve analysis using AI. And if the answer was 1, that means the symptoms are equally distributed in both. If it is 0.5, then it is a coin toss. It could be here or there, doesn't matter. But if it is between 0.5 to 1, then there is more and more. Sorry, if it is 1, then there is 100% difference between the two. I said similarity. If it is 0, then they are 100% similar. If it is 1, they're 100% dissimilar. So when they go above 0.5 and move towards 1, that increases the certainty of the difference. In this particular case, in this study, the AUC, or area under the curve, was, I believe, 0.79 and and above. So 0.75 to 0.8 was their range. So that's a very good range. So you can say that 79% accuracy or 79% certainty to be able to say this is post-vaccine or long COVID. That's amazing. So let's look at the results. The long COVID group, there were 441 patients in it. And the post-vaccine syndrome group, 241 patients, had similar demographic profile, median age 46 years, 74% versus 80% female. So in the long COVID group, 74% were females. In the long COVID, in the vaccine injury, 80% were the females. Participants with long COVID most commonly reported brain fog, altered sense of smell and taste, shortness of breath, fatigue, memory problems, and difficulty speaking. That is long COVID. So that doesn't mean that they didn't have other symptoms. There are hundreds of other symptoms, but they were common between the two. These are the symptoms that appear to be different. So long COVID commonly reported brain fog, altered sense of smell and taste, shortness of breath, fatigue, memory problems, and difficulty speaking. Participants with post-vaccine syndrome, that is vaccine injury, more frequently reported burning sensation, neuropathy, and numbness. Burning sensation, neuropathy, and numbness. Clustering analysis. So you start grouping the symptom sets. Clustering analysis identified 3 symptom-based subgroups. One enriched for neurological symptoms and post-vaccine syndrome. So post-vaccine syndrome patients were enriched with neurological symptom problems. So in simple terms, post-vaccine syndrome patients had more neurological issues. And if you would study the study and data a little more, you would see more peripheral nervous system issues. For example, the burning sensation, the paresthesias, the feeling of hot and cold, the feeling of touch, similarly buzzing feeling or the vibration feeling. So these were the kind of symptoms that post-vaccine syndrome patients had. The second group, characterized by multi-system symptoms and predominantly long COVID. So the long COVID patients had multi-system symptoms. For example, they had neurological symptoms, plus they have respiratory system, plus they had GIT symptoms, etc. So they had multi-system symptoms. And then the third group was also long COVID, and that was dominated by psychiatric and sleep symptoms. So 3 distinct groups were formed when they analyzed it. Interesting for me as well to notice that peripheral nervous system issues, that includes dysautonomia as well. Dysautonomia or postural orthostatic tachycardia syndrome, POTS, that is part of the dysautonomia, is also a peripheral nervous system problem. The autonomic nerves and the ganglions are not working correctly. The machine learning model achieved an AUC of 0.79. So if I articulate it in simpler terms, the machine learning model could predict with 79% accuracy that a patient was of vaccine injury or long COVID. And if you looked at the 95% confidence interval, that was 0.75 to 0.82. So if we took this algorithm and applied it to the whole humanity, then between 75% to 82% was the certainty that could be achieved with this diagnostic system. That is amazing. Consider where are we coming from? We are coming from people saying there is no post-vaccine syndrome. People saying every post-vaccine syndrome is actually long COVID. Then others saying every long COVID is actually post-vaccine syndrome. We are coming from that, where this ambiguity exists, to a point where you are able to say this may be long COVID and this may be post-vaccine syndrome. Conclusion and relevance. Although long COVID and PVS shared overlapping symptoms, they have distinct clinical profiles suggesting the possibility of different underlying biological mechanisms. So there, as much as there is common pathophysiology, there is a difference between them as well. These distinctions may help refine diagnostic criteria, very important, guide personalized treatment strategies, of course, and inform further research into their respective pathophysiology. So, an amazing study, and I would recommend the link to these studies are actually in the description of this video. I will recommend to read these two studies together. And I would actually suggest to read the symptom study, this study that I'm sharing, first to see clinical difference between the patients, and then look at the immunological study, this one, where you are looking at the immunological signature different. So let me just actually read this one a little for you as well. Here, COVID-19 vaccines have prevented millions of COVID-19 deaths, yet a small fraction of the population reports a chronic debilitating condition after COVID-19 vaccination, often referred to as post-vaccination syndrome. To explore potential pathological features associated with PVS, we conducted a decentralized cross-sectional study involving 42 PVS participants and 22 healthy controls. Compared with controls, PVS participants exhibited difference in immune profiles. So, what are the profiles? Including reduced circulating memory and effector CD4 T cells. So, I actually discussed that at length in this video. So, number one, the CD4 T cell type 1 and 2 are reduced, memory cells and effector cells. Increased TNF alpha CD8 cells. So CD8 T cells are cytotoxic T cells. These are effector T cells, and they are TNF alpha secreting cells, and so they are increased. PVS participants also had lower anti-spike antibody titers. They had lower anti-spike antibody titers compared to long COVID, primarily, or compared to healthy individuals, primarily due to fewer vaccine doses. Serological evidence of recent Epstein-Barr virus reactivation was observed more frequently in PVS participants. I think you know that we've been having this discussion for years, that in post-vaccine syndrome patients or vaccine injury patients, the viral reactivations are common. And Epstein-Barr virus is a very common reactivation. So here they found that in this study as well. Further, individuals with PVS exhibited elevated levels of circulating spike protein compared to healthy controls. Okay. So one last thing that I wanted to share with you. This is really interesting. When I was looking at it, I was kind of smiling and seeing what is going on. It's a sad thing as well. So let me actually go there. Dandelion. So here. So I'm still in the newer study. What is interesting in this study is the treatment strategies for two groups. Imagine a group of long COVID patients and another group of post-vaccine syndrome patients. You tell me, what is your experience how the vaccine injured patients are handled in our community here in the US? I hope you know. Most of the time they are kind of shunned and told that you have it all in your head or you're making it all up, etc., right? So guess, would they get management from the mainstream medicine? Possibly not. So look at the treatment difference between the two. Since the pandemic began, participants with PVS reported significantly more new diagnoses of neurologic conditions compared with participants with long COVID. So number one, sad thing, that the vaccine injury patients have more new diagnoses of neurological problems. Participants with long COVID more frequently reported using antidiarrheals, bronchodilators, inhaled steroids, and nirmatrelvir antiviral, and having received speech-related physical therapy compared to those with the PVS. So if you see, most of these are mainstream drugs. Now think of a vaccine injured patient who we just keep saying you are rare, you don't exist, there's nothing like this, and it is kind of a bad thing that you're saying it. Look at their treatment. In contrast, participants with PVS more often reported using black seed oil, dandelion, intermittent fasting, eastern white pine needle, and other oral medications than those with long COVID. You know what is interesting here? Many of these things we have been discussing as well. And what is sad here is this shows that mainstream medicine is not helping them. They're trying to find solutions from wherever they can find them. And they're listening to those solutions, and then they're going and using them and trying to heal themselves. So black seed oil, dandelion, intermittent fasting, eastern white pine needle, and other oral medications. And I totally believe in these. I mean, black seed oil is very, very potent and useful. Dandelion is very useful for spike protein. Intermittent fasting is great for the inflammatory state and the misfolded protein aggregate dissolution, etc. So these are good solutions, but you see the lack of mainstream solutions in here. That tells you, it's kind of a fingerprint of how we are behaving towards vaccine injured patients. Okay, so at the end of this paper, they have this table. This is the table of all the symptoms. So this is the table number 4, participant symptoms. So if you see here, there are various symptom sets and then the percentages of these symptoms in long COVID or post-vaccine syndrome. So for example, here brain fog, 375 and 85%, I believe, and then 151 and 63%. And the p-value is lesser than 0.0001, etc. So this is a list. You can see that there is a huge list. And of course, there are a lot of these symptoms that are common, but then there are symptoms that are different. That is what is interesting for me. Cool. So that is the discussion. Thank you very much for tuning in. And I'm going to continue to try to now be more regular. Book is done. Now it is being edited. There is a scientific editor who is working on it. Then there are 2 more editors with the publishers who are further reading it. So the book is being reread, cut down on various paragraphs and texts, and then the diagrams are done. 412 diagrams are done for the book. They are actually trying to figure out how do we put them. These are full page diagrams. So how can we have a book with 412 diagrams only, and then there is a description of a diagram, and then the actual text? So it's a thick book. And so they're trying to handle that to see how do we reduce the volume of the book. But they also do not want to throw out the actual useful information. But anyways, that is the status of the book. Thank you very much for joining. Yes, so Janet said 412. So Janet, I actually drew 1,000 diagrams, then composed 412, actually more than 412, and then 412 are the one that became candidate to be present. So it is almost like a children's book. Not that you are children or I'm children, but it is almost like such an illustrated book of the pathogenesis. And I believe we need to understand pathogenesis with that kind of clarity, with those pictures and illustrations. And especially in this time, post-COVID, where people have long COVID and vaccine side effects, that becomes even more important. So thank you very much. Please like, subscribe, and share, and I would see you soon. Bye for now.